Well, if I can turn to Polly, presumably you'd agree with some of that analysis. You work not just for Muslim patients, but people from across different ethnic minority communities. Is that your experience, that there are different needs out there when it comes to mental health issues?
Yeah, that is my experience, and when you talk to service users, their faith and their culture is key to their recovery and also to their ongoing well-being. So
this is not just about political correctness, as some people would dismiss. This is part of their actual treatment.
It is part of their treatment, and I think unless it's taken seriously, then what you do is, instead of improving access to psychological therapies, you actually put a barrier up before you've even started, because individuals need to believe that you understand where they're coming from in order for you to support them. And if there isn't that trust, then you're not going to access those services.
So have you got any examples of that where either it's not worked or you feel it's actually enhanced a service delivery?
Well, I've worked at the recovery end of mental health for quite a long time, and one of the things that I've always been disappointed about is that the care programme approach, which is a meeting that people with severe and enduring mental illness have, it's a regular meeting that they should have to discuss their recovery, their journey to recovery, very rarely includes any cultural or faith aspects. It's not discussed, it's not taken into account when they discuss it. There's a lot about medication. Nowadays it's great that they look at employment prospects and those things. But you have to specifically ask on many, many occasions for them to look at the faith and the cultural aspect of your well-being.
So when you're advising government on these matters, how would you advise them specifically? I mean, we can all agree that we need to look at cultural and social factors, but what's that actually translate when it comes to policy and delivering that on the ground?
I think the thing about policy and delivery is that I've always believed that if you treat people as an individual and if you really take seriously the person-centered approach, then all of those things would be taken into account anyway. We're now heading towards a huge personalisation agenda where we're looking at providing services based around the individual's need rather than treating everybody exactly the same. And I think that's the right way to go. But I think that the system needs to be set up to include all of the aspects of that individual.
But wouldn't that be really costly? Trying to take into account everybody's religious and cultural and social backgrounds, whether it's translation services or faith-based approaches, will that not be a huge burden on NHS, some people might argue?
I think that that's a really interesting question, but I think, you know, when I look at recovery services in general, there's been quite a lot of cuts in terms of the delivery of day services, for example. My experience is that often people who attend day services with structured activities, specialist employment support, they tend to not have the cycles of relapse that they would have without that support. If you cut a day service that costs $200,000 to run, it could cost you a lot more in supporting those individuals during relapse. And I think that personalisation should be seen in the same way. It should be seen as preventative and should be seen as actually maintaining well-being rather than a cost, because the long-term cost is different.
You'll be saving money because the recovery will be more solid.
The recovery will be there and the support would be there and it would be ongoing. I think it's short-sighted to look at it just in terms of, well, it will cost this much. And also, how much does faith cost and culture cost in real terms? You know,
well, how do you bring that in? Yeah, and presumably you need people of expertise that you pay to do that. Coming to yourself, Ayesha, how has Islamic counselling developed in this context? We're hearing that it's important for people of faith, and obviously many Muslims will be watching this programme. Yeah. Many families will have issues of mental health that they know of personally. What can Islamic counselling offer?
Well, firstly, there is a cry for help in regards to these issues that we are discussing. Just to give you an example, I've had many clients that have come to Sakoon either because they've went to a conventional therapist and didn't feel that they benefited from them because they did not understand the cultural or the religious influence that impacted the problems that they had. And that was one reason why they actually came. Another reason is that they actually feel comfortable to talk to a Muslim counsellor because they feel that their spiritual, cultural understanding is there, so they don't feel so frustrated to have to talk about it. They feel that they can connect with that person. And with a lot of clients that I have professional clients, I have non-professional clients, all various backgrounds that come to Sakoon. I have people that are practicing Muslims, non-practicing Muslims as well. The way I work is I'm integrative, so I apply conventional techniques such as CBT, cognitive behavioral therapy, psychodynamic approach, person-centered approach. And what I do is I apply Islamic counselling to my work, which is Islamic values, Islamic beliefs, and the spiritual aspect of Islam to help the client with their problems. And with a lot of Muslim clients, Islam is very, close to their heart. It's something that they're very passionate about. And when you use aspects of Islam, that is what a lot of clients say is what helps them, as opposed to just the conventional techniques. Mm-hmm. So I feel that the benefit of the two are really important in order to help, the ethnic community.
Well, in the second half, we'll come back and look at some case examples in more detail. I know Abdullah can't stay for the second half. If I can ask you, Abdullah, you've trained in the mainstream psychology as well as now training people in Islamic counselling. Have you found that sometimes faith itself is problematized? Sometimes professionals see it as part of the problem and not as part of the solution.
I think that we're actually in a really interesting situation. We have an opportunity here to do some phenomenal work if we recognize the significance of faith in relation to mental well-being. The reason I say that is because myself and my colleagues have been working in the field of Islamic counseling since the mid-90s. And over that period, the Muslim community has come to understand a lot of the issues that are happening for it in terms of its emotional and psychological well-being. But in addition to that, there has been an increasing understanding within professional circles that actually using a faith-based, and I stress that because there are a number of different ways of looking at Islamic counseling, but the work that we do, and certainly the work that we do in terms of training Islamic counselors and the development of Islamic counseling services, when we actually work from a faith-based model, which actually takes into consideration what people believe, mm-hmm. the impact of this on recovery, the impact of this on actually facilitating well-being is marked. I think one of the things that we often talk about in terms of training Islamic counselors is that a model of therapy which actually starts from a spiritual place but also entails psychological and emotional well-being is transformative. It's not just about a progressive process of change. It's almost as though there can be a moment of realization, and from that, change simply happens.
Do you think some Muslims might be afraid to go to an Islamic counsellor because they might feel judged? Sometimes people have all sorts of stereotypes around mental illness. Some people see it as a weakness of faith. Some people think it's simply a possession by jinn or the evil eye, because we do have these beliefs within the faith that these things do exist. How do you distinguish between these supernatural elements and straightforward mental health issues?
You've actually hit a critical issue, and this is one of the reasons why I think this discussion is so important. For me, going back to some of the things that we were talking about earlier, what's lacking is a strategic approach on the part of government to the recognition of the importance of faith in relation to mental well-being. And part of that means that one thing is lacking is research in relation to what are the needs of the Muslim community and what are appropriate ways of working with the Muslim community. So, for example, let us look at this whole issue of whether or not an individual is experiencing a mental health problem or whether or not there is an issue of jinn or black magic. Certainly from my contact with people who are involved in the field of ruqya,